Hi and welcome to today's vlog post, which is the start of a brand new series that I'm putting together where I explain the difference between different types of therapy. So for anyone that's been over to the White Barn website, you'll notice that we actually offer quite a few different styles of therapy, and I thought it might be useful if I explain what the differences are. So if you are in a position where you're considering therapy or weighing up which of the options is best, this video or this series of videos should really help you to make that decision by the time we get to the end of it. So I'm going to focus on person-centred therapy today, which is traditional counselling. So what I'm going to do is just kind of give you a bit of an idea of how it would work if you were in a session, and then I'm just going to sort of share a few positives and negatives so that you can kind of which are actually subjective thinking about it. So what I might see as a positive, you might see as a negative. But it just gives you a bit of an idea as to what you might experience, so you know whether you're making the right choice or if that type of therapy is for you or not. Okay, so first off, let me just, I'll give you an intro. I think that might be the easiest thing to do. So person-centred therapy is all about focusing on the client and what the client brings to each individual session. So it doesn't have a running theme. So if you were talking about relationship issues last week in your session, and then this week something goes off at work and you really want to talk about work, if you change the subject and don't pick up on your relationship, that is absolutely fine. The therapist isn't going to go, oh, and by the way, how's the relationship going? Because they will focus on exactly what you bring each week. So you don't have to, it's not a running story, there's no pressure to kind of feel like you've got to complete one thing before you move on to the next. It's very here and now, it's very focused on what is going on for you right at this very moment, or what are you bringing that feels really important to you. It's always about you, what you want, how you want to work. It's not about the therapist at all. And the reason I'm saying that is because there are some therapies that are very much about the therapist, in that it's up to the therapist to set you work, it's up to the therapist to direct the content of the session, and you'll discover that as I talk about other therapies in other videos. So this one is predominantly focused on the client. The client is deemed the expert in as much as the client dictates what needs to be worked on, when and how. So now what I think I'm going to do is just share with you like a bit of a role play with myself to explain to you how a therapy session might sound and how you might experience it. Okay, so I'm going to turn up at my therapy session and I'm going to say, okay, so at the moment I'm really struggling with feeling isolated. The therapist might say, okay, would you feel comfortable in sharing a little bit about that sense of isolation? The client would say, yeah, okay, so I guess if I were to describe that feeling of isolation, I don't feel like I have any friends. I don't know who I should talk to. I don't feel like I can talk to anyone. I always feel alone and quite empty. A therapist might say, okay, and that really sounds, or the way you're describing that seems like that also creates a sadness for you. Would that be the case for you? The client might say, yeah, it's really sad, and it's depressing in a way. I feel very unhappy that I feel so isolated and alone. And so then the therapist might say, yeah, I really sense that in you, and I'm really hearing that. I wonder perhaps if you felt this way for a long time. So then the client might say, well, yeah, I can't remember really when I last felt like I had loads of people around me and that I felt happy. And the therapist sort of said, okay, so I hear that this feels like it's been there for a long, long time. Yeah, it does. But then actually perhaps I can think of a time. Perhaps I can kind of think, back to there was, a couple of years ago, there was a bit of a life-changing event for me, and actually I think I kind of cut myself off from people, and I think that's when things changed. So then the therapist might say, so that life-changing situation, that was a real game changer for you, that changed how you interact with other people. Well, yeah, I guess I closed myself off. I was feeling really vulnerable emotionally, and I didn't feel like I could turn to other people. I didn't know what to say or how to deal with things. So then the therapist might say, do you feel comfortable in telling me a little bit about that really difficult, challenging, life-changing situation that you went through? And so it would go on. And so the way that person-centered therapy works is that the client brings whatever is relevant, and the therapist will really gently and delicately keep reflecting back what the client is saying and bringing, and then the client will start to open up and explore at a slightly deeper level, step by step, what they're going through, and the therapist will use really gentle interventions to kind of just, so if you've got the problem here, they kind of like, just gently move around that problem, and kind of with different phrases and ways of saying things, and sort of, what it might link to, and what other things might be connected, and just ever so delicately just sort of look at that problem in as much detail as possible to the point that the client is comfortable looking at it. And by constantly reflecting stuff back, the client begins to sort of piece together information that they perhaps hadn't previously clubbed together, and start to sort of get a new idea on how they feel about things. So it's delicate, and it's always at the pace that the client is clearly comfortable with, and it's sort of on the client's terms, very, very much so. So a therapist wouldn't say in that situation, okay, so what I'm getting is that you feel very alone. Tell me 3 things you could do to feel like you've got, more people in your life. Like, let's start looking at where you've got like loads of interaction, or okay, I know we're talking about that, but actually last week we were talking about your relationship. So does your relationship connect us? The therapist wouldn't make a diversion or deviate from that subject in a big leap. They very, very carefully work with that particular problem that issue that you're bringing. They don't move away in other ways. So you're very safe in the knowledge that what you bring is what you will talk about, and that's sort of pretty much the only thing you will talk about until you add in new information. So for me, a positive of that is that I feel very comfortable knowing that I'm controlling the counselling. A drawback for me personally is that you won't ever be offered any kind of solutions, or you won't get advice or opinions from the therapist, because it's not that kind of work. It's about you dictating the work. So some people will love that because it will give them a sense of safety, whereas other people will find it really frustrating that it's not working fast-paced enough for them, and they're not getting that kind of sense of immediate movement. So there are definitely things to consider when deciding to work in a person-centered way. Hopefully the future videos that I'm going to produce showing you complete alternatives to that will really start to help you decide exactly what fits for you best. Those videos are going to be available on my YouTube channel, so you can check that out at White Barn Therapy. And the whitebarntherapy.co.uk website has all sorts of information about therapy in general and how you can book sessions. So if this is starting to kind of help you to decide that you do want to have therapy, there is a page on the website called Our Services, and it lists all the types of therapy that we offer. That's already up there online. About the videos will be being added gradually as I start to make them. So I hope you found this useful, and I hope this has kind of done person-centred therapy justice. I would like to just sort of add a little disclaimer at the end that I have never done a video roleplay with myself before, so it was a bit ad hoc in as much that a realistic therapy session would be really kind of calm and respectful of your issues, and that the way I talked to myself was perhaps very direct. So it's just to give you a taste of, rather than a specific. Okay, I look forward to sharing my next video with you and helping you work out what type of therapy you want.